Friends and family, what's up? Justin Haushin, Epicenter Wellness, coming at you with part two of a short series dedicated to self-massage techniques, self-care for the forearms. In our previous video, I did the yin channels of the forearm or the flexor compartment. In today's installment, I'm going to cover some basic techniques for the yang channels or the extensor compartment. So you'll find part one in our archives. You can check that out. So let's get to it here. Just a quick review of concepts, like I mentioned in our last video. So when I say proximal, that's going to mean up toward the head. When I say distal, that means down toward the fingertips. Now, when I say lateral, that means toward the thumb side of the forearm. When I say medial, that's toward the pinky side of the forearm. Okay. And with reference to Western anatomical position, the front is the flexor compartment or the palm side. And then on the flip side, that is the back of the forearm. Okay. All right. So my right will be applying, my left will be receiving. And like we did in our last video, we're going to start off with just some circular gliding, mild pressure. So gliding, it's a superficial fascia manipulation. Generates warmth, relaxes tension, kind of warms up the tissues. You don't want to get right in and just start mashing out tight muscles. You want to let your body know, give it some love. So I'm just doing a few passes, going down from the elbow to the wrist, and then going back up from the wrist to the elbow. And as you do this, you can feel where there's just a little extra tightness, a little extra tenderness, a little gumminess. I'm using the palm side of my hand, my applying hand, but as I mentioned in the previous video, you can also use the back of the hand as a contact point. You can use the antithenar eminence muscles as another contact point. Okay. So the large intestine line, generally speaking, from the anatomical snuff box, which is between these two tendons when you lift the thumb up like so, you run from there to the lateral epicondyle large intestine line. The Sanjiao channel, the triple burner, that is the middle of the forearm, so about the middle of the wrist up to the lateral epicondyle. And then the small intestine is on the other side of the ulna, going toward the medial epicondyle. We won't be working so much in here today because from what I see in clinic and in personal experience, these muscle bundles here tend to be more problematic. Um, yeah, tennis elbow, pickleballers. You spend a lot of time at a computer, a lot of typing, a lot of mousing. All these kinds of things can contribute to the onset if there is no remedial self-care program. And so this is what we're here doing today. All right. So we did a little bit of warm up. Now I'm going to be using, so this is the knuckle of the pinky. I'm going to use this as my contact point. And the distal, let's say the distal half of the forearm on the large intestine line is mostly bone. You'll feel the radius right there. But as you get up to the proximal half, then you're getting into some muscle bellies. And right away, right here, I can feel it's a little tight. And it doesn't even take a whole lot of pressure to get that feeling of tightness and achiness. So that dull muscle ache, yeah, you can give that some attention. And we want to make the distinction between that dull, achy muscle kind of feeling, sensation. By the way, I'm working up toward the elbow. And that buzzy, fuzzy, nervy sensation. That you don't want to elicit that too much. A little bit is okay, but not too much. Okay, so for those of you familiar with channel theory, I'm at the large intestine 9, 10, and 11 acupuncture points. And yeah, it's tender in here. So I'm applying some moderate pressure at this point, help break up some of those tight muscles, help get oxygen-rich blood into the muscles and fascia. Now I'm working my way back down toward the wrist. So tennis elbow. Treated a fair number of tennis elbow cases in my work as an acupuncturist. Much mention is made of the common extensor tendon, but that extensor tendon is related, it connects to the muscle bellies here in the middle of the forearm. So relieving any tension in these muscle bellies can have preventive value with respect to the um, outer elbow. Okay, so now I'm on the Sanjiao line. I'm between the radius and the ulna, the two bones of the forearm, analogous to the tibia and fibula in the lower leg. Now here, close to the wrist, there's a fair amount of muscle belly. There's an important acupuncture point here, Sanjiao 5, triple burner 5. Now here, there's this characteristic crunchy kind of feel that kind of goes along with muscle stiffness. Now, if left unattended, the tissues can, with the passing of time, insidiously, we're talking about very slowly, like slower than the grass growing, insidiously become myogenic. So there's a persistent decrease of blood flow to an area, and then that can set the stage for inflammation, degeneration, and damage. Coming up to the elbow. Yeah, so as I do this here, as I cross fiber here, my fingers are actually moving, which is kind of amusing. Nothing really to worry about. So you can alternate your contact point. You can use the pads of the middle and index finger. You can use your thumb, but you have to rotate your receiving forearm inward a little bit. Okay. Yeah, so now I'm at about the junction of the proximal third and distal 2/3, and ooh, tight, achy. So at this point, I'm about like moderate to severe, or moderate to strong pressure. You know, your attitude is therapeutic, is compassionate, is supportive. It's not like you're trying to punish the muscles here. So now I'm still on the extensor muscles, but here I'm more toward the pinky side. I'm just, well, if I'm being technical about it, I'm just lateral to the edge of the ulna. Yeah, that's tender. Good hurt though. So generally speaking, you know, anywhere from 5 to 10 circles, circular cross fibering um, movements, and then you can move a finger breadth over. Now, there's a small muscle called the anconeus, which is, well, if I'm being technical about it, it's behind, posterior, and medial to the lateral epicondyle here. It's like right in that little crevice near the proximal end of the forearm, and it is tender. Now remember, all the structures of your applying hand working together harmoniously so you're not overusing any muscle groups. Working my way back down finger breadth by finger breadth in the direction of the wrist or distal. Okay, and we'll finish up with a little bit of round rubbing up and down. Now, if you have a good CBD cream, you have a good massage cream, or I mean, you even use shea butter. I use shea butter when I'm working myself. That can be something nice to apply after you've done these other cross-fibering techniques. Okay, now I'm going to show you a little pro tip here. So, tennis elbow, lateral epicondylitis, pain in the extensor compartment of the forearm. Now, what you want to look for is a tender spot above the elbow joint or proximal to the elbow crease, and it's the large intestine 12 acupuncture point. So you won't find it by pressing super deep because then you'll push right past it. I know it's a challenge to see in this video here, but okay, well, here's the lateral epicondyle, proximal to it. And there's a section of a muscle belly, it'll feel ropey, like a thick string, I guess more ropey is accurate to say. And as I roll over it, it's pretty tender and it's tight. It has that dull, achy character, not so much of that buzzy, nervy. And it's if you're pressing into the bone, you're pressing too hard. Yeah, that's that good hurt. Yeah, and I can feel it refer down into the forearm. Referring sensations, that's another common thing when you're doing this kind of self-care. Typically not problematic. So my contact point is the pad of my middle finger. And then just kind of end it with a little softer technique there. Okay, now another point you want to look for is on the lateral head of the triceps. So I'm a little further back here, I'm a little posterior, and that thick muscle belly, I'm using my middle finger as the contact point because I can curve it and hook it around. But again, investing in a small massage instrument might make sense to you if you're really into this level of self-care. Yeah, right there. That's tight, that's tender. Good hurt. So here we're at about the Sanjiao 11 acupuncture point. Yeah. And as I do this, I feel this refer down actually into the pinky. So with this deeper work, I may have mentioned before, 5 to 10 passes. You don't want to overwork the dough because then you might cause a little irritation. Okay. And we'll end it with a little softer technique. Okay, well, when you're doing this on your own, you want to do both sides. Hopefully you found this helpful. Share it with a friend or a loved one, if the spirit moves you, hit the like and subscribe button. Stay tuned for future videos. All right, take care.